Emma Field, COVID-19 Coordinator at the Murrumbidgee Local Health District. Okay, so today we're announcing 12 new cases up until 8 p.m. last night. Of those 12 new cases, we have 5 that are located in the Griffith LGA, 3 in the Albury LGA, 3 in Wagga LGA, and 1 case in the Murray River LGA. We've seen a considerable decrease in the numbers over the last couple of days, which is very pleasing to see. Albury's outbreak has slowed. That's also very pleasing. We've seen the aged care facilities that were affected in the Albury area now taking visitors, which is really it's quite impressive that, you know, that's got to this point. So we'd really like to, you know, congratulate the Albury community and all of those people involved in that outbreak for, you know, coming together with all of those strategies to get to that point. So I think, you know, the other thing for us is very pleasing, the Monday's release of the vaccination numbers. We saw a very big increase, and we are now seeing that the Murrumbidgee Local Health District for 16 years and over, first dose vaccinations are at now 98%. Second dose completions are at 94.5%. So very high numbers, extremely high numbers, and we're very pleased for the community coming forward across the Murrumbidgee and taking up that call to get vaccinated. So in that very important 12 to 15-year-old age group, which we've been focused on each week because of the eligibility becoming you know, a little bit later for that age group, and we know that we've had some outbreaks in schools, and we know one of the protective factors is for those 12 to 15-year-olds to come forward and get vaccinated if they've got those younger siblings, in the absence of being able to get vaccinated in that younger age group. For first dose, we see now this week it's gone up to 84.2%. For first dose and 74.4% for second dose. So that's very pleasing to see. We are still working though very strongly in that age group. Today we're down in Albury again and we're at those schools. We're vaccinating, very much opportunistic vaccination. And we're out at Deniliquin. So we're really trying to support where we can. Not just boosters, but also have we got everyone in that 12 to 15 who wants a vaccination.
How are those booster shots going as well?
Really good. We've seen a big probably pick up this week, and that's actually indicative of the eligibility that commenced back in March, April. So we saw that 1A, 1B cohort initially come forward, and now we're starting to see the next eligibility cohorts coming in. So we have seen an increase in vaccinations, particularly this week, and we have been obviously targeting that age group, those cohorts as well. Just reminding people if they've had a vaccination in the Murrumbidgee Local Health District clinics, that they're eligible to come forward. You've hit the 6-month mark, come in and get a booster shot. So people are coming in, they're telling us they're receiving those texts, which is pleasing, and people are getting their booster doses.
With the Griffith numbers, that's obviously it's grown in the last couple of days. Are you concerned about the outbreak there?
No, look, to be honest, all of the cases that we're reporting on today, the far majority have got epidemiological links and household contacts. So when that is the case, that's very pleasing to hear and see. So we are not concerned about any community transmission in Griffith. So they are known to current cases.
Is it the same in Wagga? Are most of the
Yes.
cases are seen linked to other cases, or is it community transmission?
No community transmission. So we're seeing those epidemiological links in Wagga as well. Again, very pleasing. So even though we've seen that jump yesterday till today to 12 cases, we look at have they got a link, and we're seeing that link. Yep.
Do you still think those cases are going to jump up and down?
Yes, I do. I do think they will, because we're seeing households, you know, affected obviously by COVID. If someone has got COVID, you know, obviously everyone, you know, tries to isolate as best as possible, but we do see some, you know, obviously some COVID in the households, and we will see, you know, some of those people then become positive. So we will see jumping around of numbers, but also too, as you know, we've had an opening up of our borders borders, and Victoria's opened up. We are naturally going to see, we've got 1,200 cases there yesterday. You know, when those borders are open, that means that people are transient, and that means that we will have, you know, that higher rates coming across and within the community. So I think, you know, we still need to be vigilant, and that's the big message is, of those 4 things that we always say around check in with your QR codes, we're hearing that's working really well. People are getting those notifications, those push notifications, and they are monitoring for symptoms, and they are getting tested. We've had some great testing numbers this week in Wagga. One day there we had 550 people come through those 2 clinics. So that tells us that the testing is good. People are coming forward. We've got a sense of confidence in the community. So we need that to continue. So again, message should be, if you are at all, have got any symptoms, come forward to one of our clinics for testing. But also, if you have been in one of those exposure sites and you have been contacted by a public health unit, come forward for testing. So I think, you know, that's something that we're very, you know, happy to see, the testing numbers.
The region seems to be dealing quite well. A couple of months ago, you guys pushed for, you know, living with COVID. We're adjusting pretty well, aren't we?
We are. I mean, I personally, you know, am very impressed with the Murrumbidgee communities. They're really, as I said, the testing numbers are still good, still high. People are still heeding that warning and being vigilant, which is exactly what we've asked for. So that to me is very pleasing to see. We don't want people to be complacent with testing because then we don't know what's circulating in the community. We also don't want people to become complacent at this stage with QR coding and checking in. We need, you know, that's there for you. QR coding is there for the community to be able to say, hey, just FYI, you've been in the same place as someone who is positive. So it allows people to be wary and to be on the lookout for any symptoms. And we can get onto these COVID infections quickly. As you can see, we treat the vast majority of COVID cases in the community. So they are not in hospital. That's another one of our indicators that we're very pleased to see. If they were in hospital and they were serious illnesses from COVID, that's concerning. And that is what vaccination has given us. Vaccination has given us a very, you know, we're seeing that the cases are being treated at home and in the community and with very mild symptoms. So the proof is in the pudding. Vaccination has worked, and we have seen how that's affected the health outcomes of our population, of our community, which I think, you know, we talked about it, but now to see it is extremely pleasing.
Just a breakdown, do we have any patients in hospital at the moment being treated?
No, we don't. We don't have any patients in hospital at the moment. Oh, geez. Take that back. Take that back. Yeah, no, so we do. We have 3 people, do we? I thought they were out. Oh, right, okay, yep. So the 3 people in hospital, and the far majority are, I think we're treating over 50 at the moment in the community. So, and that's where we're sitting at the moment.
Cool. Thank you. Thanks so much.
Good.
All good.
Oh.